and gentlemen, welcome to Afra Turk TV. Global health has become one of the top shows, as you know, in healthcare. And we are focusing on healthcare in different countries, from Nigeria to Somalia, from Ghana to Senegal, from Tanzania to now all the way down to South Africa. And today, I have an amazing leader, a true leader, which has won a special award from Somalia for serving Somalian people as the director of the very important hospital in Mogadishu, Somalia, Türkiye, Recep Tayyip Erdoğan Hospital Director, Professor Dr. Mevlüt Karataş is with us. Welcome, sir. So honored to have you today. How are you?
Fine, thank you. Alhamdulillah. How are you?
Thank you so much. I know how busy you are because the first episode has been a huge interest. We couldn't hold all the requests, and I'm so excited to have you here. Our guests and people who approached us from Somalia, they told me, Dr. Yavuz, you need to ask, especially Professor Dr. Mevlüt Karataş, about what he did in Somalia. They told me you won an award there because of your service. You worked, and your team worked very high. You really changed the landscape in healthcare in Mogadishu, and that's why we invited you. Thank you so much for coming.
Thank you. Thank you very much.
Thank you. Ladies and gentlemen, again, I want to highlight this. In 2013, something happened. There was a call to the people, to the world, and Somalia was a place where the entire world has forgotten. But one person did not. Our current President, Recep Tayyip Erdoğan, he took a flight when it was a situation where he actually endangered his life. And he took in that flight very important people who are ready to analyze and serve the drought, as well as the people who are dying because of lack of food, lack of malnutrition. And where everyone left, Turkey was there, alhamdulillah. And our president himself flew with a very important crew in 2013, and actually he could have lost his life. During his flight, when it was going down to Mogadishu, the flight had a turbulence and one of the plane touched, but alhamdulillah he survived. And 10 years later, our very good friends, after Recep Tayyip Erdoğan, our president, Professor Dr. Mevlüt Karataş came to Somalia to serve our Somalian brothers and sisters at the Somalia, Türkiye, Recep Tayyip Erdoğan Hospital. And today we will talk about what Somalia is for the entire African viewers. What is the perspective of Professor Dr. Mevlüt Karataş about Somalia? What he thinks Somalia is, how he established this hospital, what services they give, what type of patients they have seen, what type of surgeries they have done, how many residents, because it is a very important residency training program now in Mogadishu. I think they have trained more than 200 doctors in Mogadishu. So Turkey is not only supporting in military, in police, but also in healthcare. And Turkey has the largest embassy in the world in Mogadishu, alhamdulillah. This shows the brotherhood between our brothers of and sisters of Somalia and Turkey forever, inshallah. With that, Dr. Mevlüt Karataş, tell me, what is Somalia? What does Somalia mean for you? And what do you want to share about Somalia? Because Somalia was your first experience in Africa. Tell me what Somalia means for Professor Dr. Mevlüt Karataş.
Thank you very much, Dr. Slay. Firstly, at the beginning, I want to convey my best regards to Somalian brothers.
Thank you.
Because I lived with them. They hosted me in their country. Somalia is the important region. As you know, the Somalia located at the eastern part, the Horn of the Africas, and the seaside. And actually, if we look at the history of the Somalia, there is a tight connection between Ottoman Empire and Somalia.
Yes.
We shared the history, and they are all Muslim. They are all Muslim brothers, and actually they have a good country, seaside. The biggest seaside of the African country is Somalia, in the biggest seaside. You know, Indian Ocean.
Yes.
Indian Ocean, and good weather and the good vegetables
And good people.
and good peoples and warm peoples actually. I had a chance. I had the chance to serve to Somalia actually.
MashaAllah. I'm so proud of you.
Yes.
Seeing it a chance is your kindness.
Yes.
Thank you.
Last year, the story started last year.
Yes.
Uh,
In 2023.
yes, 2023 August, and the finish
About 2 years ago. 2
2 years ago, but finished at 2024 March.
I see.
Yes.
8 months, right? 8 months.
8 months. 8
Very
months.
good.
Yes. Firstly, in the airport, we came to Mogadishu.
Yes.
I wonder what is the
You fly from Istanbul
Yeah,
or Ankara?
I flight from Istanbul to Mogadishu, and the first meeting in airport,
Yes.
and there are many. I watched that there are many security. Firstly, in this region, there is a Turkish companies, the airport and the
Hotels, many things are done by
many
Turkish
things,
people.
yes. Then we visited the hospital with our team doctors, and actually the hospital area is a large area, 63,000 square meter.
Huge.
Yes, huge. There is a faculty, health science university faculty. There is a big mosque and the hospital main building, 2 floor, and the big garden
Very nice.
and the technical parts and etc. The hospital had 250 patient bed. There are many units in hospital, intensive care unit, surgical operation rooms, burning center, and newborn unit, newborn care unit, and the other services, endoscopy services, blood center, dialysis centers.
Pretty much a very large hospital. All functions. Yeah.
Actually, in Turkey, there is a first step, second step, and
Yes.
3 step.
Yes.
This hospital, 3 step.
So it's a tertiary hospital.
Yeah,
If not a primary care, not specialist,
Well-
almost like university hospital because you're giving training as well.
Yes, and there were 1,100 employer, health employer
Big, very big.
in hospital, and the nearly 70 of them is Turkish health staffs. Actually, 20 or 22 medical doctor, and the others nurse, administration, and security. So there is a good combination between Turkish health staff and the Somalian health staff in this hospital. There was a big respect to each other. We treat our Somalian brothers in surgery and other health issues. And this hospital, especially the important hospital, why? This hospital is the only hospital give residency programs.
This is
in
very
Somalia.
important.
Yes.
We are giving training. We are
Only,
training, mashallah, and the only one.
yes, we are still
Like we are the only Turkish TV broadcast in Africa, and there was only university hospital giving training. Turkish hospital
this is
in
this
Mogadishu.
is the only currently
Wow.
only hospital that giving training to Somalian doctors,
Medical doctors.
Now, actually, there are more than 200 medical doctor in this hospital,
Big now.
and then the residency doctors in each branch.
So you give internal medicine training,
Yes, internal medicine, surgery,
women's health,
OBG,
OBG, different emergency.
Yes, there is a big emergency service. Personally, I observed the hospitals.
Yes.
And because we talk about the director period of me, I observed the hospital. What can I do? What can how can I open a new units? What this hospital needs?
Mashallah.
I searched, and with my team contains Turkish brothers and the Somalian brothers, and we put target.
Very good.
The first thing, operation. Which operation? Open heart operation.
This is a huge goal.
Yes.
It's not easy to establish an open heart surgery.
In Somalia, more than 50 million people live in Somalia. You know, the first reason of mortality in all over the world, cardiovascular, especially myocardial infarction. But we have angio unit, coronary angio unit, we have coronary ICU unit, but we don't have any open heart surgery in our hospital, and we decided to start the first open heart surgery in Somalia.
I think some people maybe told you you're crazy. You're just thinking. Because if you want to do something good, there are always people who wants to avoid that goodness.
Yes,
Were there people who criticized you for that?
yes, yes.
So they said you cannot do it?
As you know, I worked as a hospital director, but I had many meetings with university rectors, the other hospital
You have to commit.
directors. Yes, yes. Some of them said you cannot do this because it is very difficult. You need a team, a surgery team. If you don't have any surgery team, you cannot do this. But
That's not what we learned from Professor Dr. Necmettin Erbakan.
yes,
If you have iman, if you have faith, you
yes,
can do it.
you can do it, and
If you plan it, you can do it.
and Alhamdulillah, we did it.
Mashallah.
With it, we had the first open heart surgery in Mogadishu, in Somalia.
Amazing. This is
Yes.
amazing service. Mashallah.
We first we arranged the surgical room.
Yeah.
And the
Has to
second,
be a special room.
yes, special room. And the second step, we arranged an IC unit for cardiovascular surgery, and we bought heart lung pump. You know, this is the
Very expensive.
very expensive and a very important device for this such as operations, and we bought it, and then we need a team, and we arranged the team from Istanbul. There is a hospital, Siyami Ersek
One
Cardiovascular
of the top
Surgery Hospital.
hospitals. Yeah.
Yes, the most
From-
famous,
from-
most famous hospital of on cardiovascular surgery. We arranged 7 staff from this hospital. They came to Mogadishu.
This is
I want to special thanks to Dr. Mehmet Kızılay.
greetings to Dr. Mehmet Kızılay. Thank you.
Yes,
Thank you, you and your team. Thank
yes, he is the head of this team, and we had a meeting. I asked the Dr. Mehmet Kızılay, hocam, we can do this operation. He said yes, we can do.
you. He support you.
Yes, yes. We arranged all surgical patients, and we start the operation in 1994 March.
Okay.
The first operation, he was a old man.
Your first patient was an
Old man, yes, yes, maybe 70 or 75, maybe 8 years old. And this is the first case, and so
It's a big risk, actually.
we asked the patient, "Are you sure?" He said, "Yes, I am sure because I believe to Allah. I believe that the Turkish doctors is the best doctors and all over the world.
Yes.
I don't want to go to other countries because before this operation, all these patients going to Taiwan,
Yes.
India, and other countries. They are paying more money.
Yes.
They are
During recovery, you have to stay there
more time,
Yeah.
more time, and it was very hard to had a surgery, open heart surgery.
And it's a huge loss, economical loss for our brothers in Somalia. If you can solve it inside Mogadishu, it's amazing. You know?
Yes, I want to thank a special thank to Prime Health Minister Ali Hacı Adan, Dr. Ali
Greetings
Hacı
to
Adan.
Ali Hacı Adan. Thank you so much, Ali Hacı
I
Adan.
convey my special respect to Dr. Ali Hacı Adan, and another special thank to the President Hasan Sheikh Mahmud.
Honorable President Hasan Sheikh Mahmud. Thank you so much from Atatürk TV. Our director, Professor Dr. Mevlüt Karataş is conveying his special regards from Ankara to you for supporting this very important service for our brothers in
And
Somalia.
another special thanks to the Turkish Prime Minister, Turkish Health Minister, former Health Minister Dr. Fahrettin Koca.
Special thanks to Fahrettin Koca, our professor, who is really supported this mission. Thank you very much, sir.
Yes, and we have to thanks to Recep Tayyip Erdoğan, because this story start with Hasan Sheikh Mahmud and Recep Tayyip Erdoğan.
Erdoğan together.
This hospital established in 10 years ago. 10 years ago. And actually we examined more than 2 million people in this hospital, and we had more than 50,000 operations in these operation rooms.
So the population is 50 million. You did a physical exam on 2 million people in that.
More than 2 million,
More than
maybe 3 million.
Wow,
Maybe
that's
3
amazing.
million. Yes.
Like 1 in 20 Somalians stop by in Mogadishu, probably.
Because this hospital is the biggest hospital and the main hospital and the training hospital and the most popular hospital and the end stage hospital.
Were there patients coming outside Somalia?
Yes,
Like from Ethiopia or other places?
not Ethiopia, but outside of Somalia. Because this is the big hospital. Yes, but as you know, the Somali people is going on, and now 50 million. Next years maybe it will be 60 million years. I gave advice. We need another big hospital. Another big hospital. Yes, we do quality. We do our works very well, but we don't have any bed. Yes,
It's limited.
it's limited. Yes, so we had operated 8 patients in this period.
All open heart surgery?
Yes, 8 open heart surgery successfully. We finished this surgery, and
Nobody died?
nobody died. One of them was children, a small baby.
From baby to age 80, you had done 8 different surgeries.
Yes.
Huge success.
Yes. So the media, the social media showed all our operations, all our doctors, and this is the first target. And we planned the second target. Our second target was to open a new hospital.
Open a new hospital.
Yes. Yeah, new hospital. There was an old hospital that was called as Deva Hospital. Deva Hospital, but this hospital is not working. Was not working,
Yes.
and we have to open this hospital. And then we opened this hospital as gynecology and children hospital, obstetric and gynecology and children hospital. Firstly, we opened 5 polyclinic in this hospital, and we calculated how can we restore this hospital.
You did an entire restoration of the hospital,
entire
new
restoration.
polyclinic situation, arrangements. You actually rebrand and re-strategize everything.
Yes, but we opened this hospital, Deva Hospital.
Congratulations.
Inshallah. Yes, and our third target to open oncology center.
Cancer is a big problem.
Yes, not only cardiovascular surgery patients going the outside, but also the cancer patients going outside.
Somalia going to Taiwan, India, Turkey, or United States if they have money, or UK, right?
Yes. First, we decide to buy the oncologic equipment, medical equipment. Then we connected a mentor, professor, oncology professor Muhammed Ali Kaplan from Diyarbakır. We connected with this professor. He was working a mentor with you.
Having a good mentor is very important.
Yes, it is. It is very difficult to find a medical doctor, medical oncolog,
Dedicated to
dedicated.
support.
Yes, he supported us from online, and
Let's say hi to him.
yes,
Thank you very much for your hard work. Thank you for supporting Mevlüt, Professor Mevlüt in this mission. Thank you very much. We want to thank you for your leadership all the way from Diyarbakır to Mogadishu. This is a big story. You know, Diyarbakır, Mogadishu are brothers because of your support. Thank you very much.
yes. This was the third target, but we bought all equipment. But now I don't know. Maybe they opened this center. I don't have any information from.
We'll check.
İnşallah,
Check inshallah.
inshallah. And you know, the Somali Mogadishu region, the warm war region,
Yes.
and there are many orphan
Unfortunately.
children's, and we decided to open child monitoring center.
This is a huge service.
Yes,
For the orphan
yeah,
who have no mother, father.
for orphan and the other children's
Children.
for abused
Big social
the abused children,
Mashallah.
physical, psychological, sexual abuse children, and we opened a center.
So you are rehabilitating the children,
Yes,
both psychologically as well as physically.
yes, yes.
Mashallah.
And we opened a cerebral pulse center. The birth rate high in Somali Mogadishu, but the pre-birth health care is very bad.
That's something I want to find out as well. Like when you're looking Turkey versus Somalia, because 20 years ago, Turkey had also very high
Yes,
newborn rates,
But-
pre-birth dates. Now, after the reform, it moved up. Do you see like similarities between Somalia and Turkey?
not similar. Somali level is very low.
We have to work harder.
I gave advices to Somalian health authorities. The first thing you need to establish public health
Yes.
centers, public water, vaccination, and other things. I want to give you information. The diabetes rates is very high in Somalia, especially in children. And the diabetic foods.
I see.
Diabetic foods
Is it
very
type 1 or type 2?
each other.
Both of them are
both of them.
available.
And,
Is it because of a bad diet or genetics? I'm trying to understand.
yeah, they are consuming very high amount of
Carbohydrate.
sugar, and we can observe easily very high rate of diabetic patients and diabetic foods,
That's bad.
and amputations, leg amputations, foot amputations very high. And we decided to organize a diabetic foot symposium.
Very good.
We
We have done symposiums,
Yes, we
educational
had-
programs.
Yes, education program. We had an education program, and it was very nice because all Somalian health authorities and doctors, internal medicine doctors, endocrinology doctors, and orthopedic doctors, and came to symposium and give their experiences, share their experiences, and we decided to do another symposium to approach to multi trauma.
It's a war zone, right? There are some wars
This
happening.
war zone, and our doctors, özellikle surgical doctors, had surgical experiences, thoracal surgical experiences, neck, face, leg. In the war,
Gunshot wounds.
gunshot bomb, yes. And then our staffs had many experiences, and we decided to share these experiences to other doctors, and we did a good conferences about symposium about multi-trauma, the 5 stars in a 5 stars hotel,
Very good.
Lekalote Turkish hotel, and other education programs for nurses. And I said to you, this hospital, educational hospital, training hospital, we had examination for residency doctors
Very good.
in Turkey, TUS examination, like TUS examination. And we got more than 20 residency doctors after this examination. And
They are inside training. You're training all these
yes,
doctors.
they
They
are
are becoming
We are
Specialized doctors.
they are training these doctors 4 years, and the last 6 months these doctors came to Istanbul in Health Science University. They finished their residency program in Istanbul.
Greetings
And-
to Professor Dr. Kemal Aydın, our rector.
Kemalettin Aydın.
Kemalettin Aydın is an amazing leader, and he is also very much involved, our rector, in Mogadishu. So greetings to Kemalettin Aydın now.
And they at the end of the residency program they have examination, staff examination. Then they take their certificate and come to Mogadishu, and they work for Somalian people.
Very-
So this is very important issue, very important education program. I want.
This is really the top. Yani.
Yes, this is it.
You know, it's not easy to train a doctor, but it's not easy to train a specialized doctor. It is even harder. So I want to thank you again. We are at the end of this episode, but in our next episode, we will talk more about, you know, how you were received in Somalia, what awards they have given to you, and your impressions and your recommendation for the Ministry of Somalia Health Ministry, as well as for other countries in Africa, what they need to do. Maybe in the future you will go back again and serve them. Maybe in other countries, maybe we'll go together, inshallah, to serve. Thank you very much. It was an honor having you at Global Health. Thank you very much, Professor Dr. Mevlüt Karataş.
Thank you. Thank you.
Ladies and gentlemen, this is the end of our episode. We will also host Professor Dr. Mevlüt Karataş again to understand what he has done more, and most importantly, what is his recommendation to improve healthcare, not just in Somalia, not just in Mogadishu, but also across Africa. What are African brothers and sisters, where we believe African solutions for African problems need to do to improve their healthcare system, and what are his recommendations? We'll get back to that in that episode. This is Dr. Selim Sılay, wishing you a wonderful rest of the week. Take care and all the best. Bye.